Hi, I'm Erin with Best Life Physical Therapy. I'm here today to talk to you about a self-treatment technique that you can do when you're having sacral pain. Sacral pain is a pain that is right around here at the base of the spine. So if you're having pain here and you've tried some of the other things that I've issued you to do before and it's still not feeling much better, then we can try to do some of these techniques to calm down the nervous system, because it may be playing a role in the fact that you're still having pain in that area. So the first thing that we're going to do to calm the nervous system down is our Trigeminal Nerve Reboot. We've talked about this before, potentially, and this is the way that I'd like you to do it. So you're going to, first of all, reboot your diaphragm. So to do that, you'll take your right arm into your body, turn your head to the left, and cough twice. So it's a double cough twice. We'll go ahead and do the other side. Then we'll reboot the scalenes. So we want to get the breathing muscles calmed down. So as you take a regular breath in, you'll exhale your breath all the way. And at the end of that exhalation, I'll have you go ahead and hold your nose and bear down like you're going to pop your ears. So it's a downward pressure with the diaphragm. And then these muscles on the sides of your neck should feel much looser after you've done that. Your third component of the trigeminal reboot is to go ahead and make up some saliva in your mouth. So move your mouth around. And then go ahead and take your left thumb under the soft spot behind your jawbone and open your jaw gently into your hand. You're going to go ahead and kind of try to bring your cheeks into your teeth and smile and glance down at your toes. You're doing all these things at the same time as you're going to be doing some deep breathing. So I'm going to try to smile, do deep breathing, be glancing down at the toes at the same time. If I wanted to bring my vagus nerve into it, I would take my right middle finger and place it into the concha of my left ear, where there's an acupressure point for the vagus nerve. You're going to hold this position where you're smiling and glancing down at your toes for about a minute. So it's 6 breaths. And when you finally can let go, everything really relaxes. It's a nice, really relaxing feeling. Now we're going to move on to specifically sacral issues. So we're going to bring your foot up onto the table of maybe a bed or something like that. And I'm going to have you push your foot into the edge of the mattress and take your hands like this, and on the inside of your knee, right below your knee and above your knee, you're pushing inward with your heel, and you're hit on the bottom and the top of your knee about 6 or 7 times. And we can go ahead and we can try that same thing on the other side as well. This is going to kind of reboot and release the tailbone and the sacrum a little bit. Good. And now the next thing we're going to do is release the psoas. So in order to release the psoas, you're going to lie on your back and you'll bring your foot up in the air. You're going to take your hand, I'll do it on this side. You're going to take your hand and resist pushing away with your heel, with your bottom 2 fingers, and with the top 2 fingers you're going to push that ankle out to the side. So before you even start this whole thing, you're going to hike up on the opposite hip towards your hip towards your rib cage. Then you're going to press away with your heel and push outward with your foot, and you'll hold that for about 45 seconds. And it's resisting hamstring and resisting hip internal rotation. And then after you get finished with that, about 45 seconds, then you'll put it down and you're going to take your left arm into your body and turn your head to the right and cough twice. And you're going to reboot the diaphragm again. And so with the combination of all of those techniques, that should help to really calm and relax the entire sacrum and take care of some of the sacral pain that you're having, because it's more autonomically driven than we thought. Autonomically driven, what that means is that the nervous system that regulates our fight or flight or our rest and digest has probably got that sacrum upregulated. And if we can kind of calm that down, then those joints will actually start to do what we want them to do again, which is to function without hurting and to move in 6 degrees. We only have 6 degrees of motion at the sacrum, so they should be moving upward, downward, side bending, and rotation, 1 degree in each of those directions. So it doesn't move a whole lot, but it needs to be moving in those 6 degrees. Thank you for watching. Be well and live your best life.